around 630,000 people died from AIDS-related illnesses worldwide. Housing Works began this tradition of the reading of the names in December 1995, emerging from an act of civil disobedience and a 24-hour reading of names. This year, more than 140 volunteers have come together to read from a list of over 30,000 community-sourced names, continuing this powerful act of remembrance and resistance. This tradition is not only about mourning, it's also a call to action. While it's important to acknowledge how far we've come, from the dark days of silence and stigma to life-saving treatments and prevention strategies that offer hope, we must also face the reality that much of this progress remains fragile. The HIV/AIDS epidemic is not over in every community. Disparities in access to HIV prevention, treatment, and life-saving housing continue to prevail amongst communities of color, women, older adults, and those living upstate and on Long Island.
Hi.
To address these disparities, the Ending AIDS New York Community Coalition calls on our governor and the New York State Legislature to take action on the following priorities to end the epidemic across the state. First, house all New Yorkers with HIV. Research shows that stable housing is the most critical factor for the health of people with HIV and is key to preventing the virus from spreading. In New York City, HASA has helped over 28,000 low-income New Yorkers with HIV secure and maintain housing. Yet up to 2,735 living upstate and on Long Island have been left behind because this program is not available outside of New York City. Governor Hochul has the power to end homelessness for people with HIV, and so we call on her to provide equitable access to rental assistance for low-income New Yorkers with HIV in every locality, saving lives and money. Second, we must enhance access to PrEP amongst communities most at risk for HIV transmission. We now have highly effective medication to prevent HIV transmission, known as PrEP or PEP. Yet, stark disparities in PrEP uptake amongst persons of color, women, and older adults undermine the potential of this powerful HIV prevention tool. We demand investments in tailored, culturally competent outreach and reduced barriers to accessing PrEP, regardless of insurance. We also must support New Yorkers aging with HIV. By 2030, 70% of New Yorkers living with HIV will be over the age of 50. Aging with HIV can increase the risk of other health conditions, as well as higher levels of depression and social isolation due to the effects of HIV stigma and from losing friends and community members at the height of the HIV/AIDS epidemic. To adequately address the unique medical and social needs of long-term survivors, New York must prioritize investments in targeted support and resources for older adults. Fourth, New York must invest in jobs for HIV peer workers. By reflecting and representing the communities in which they work, peer workers support our goals to improve health equity and reduce disparities. Employing peer workers is a cost-effective strategy to expand healthcare access, help under-resourced organizations, and create economic opportunities. New York must strengthen employment opportunities, workforce readiness, and job placement services for peer workers. And finally, we call on Governor Hochul to authorize overdose prevention centers, OPCs, statewide. OPCs are vital interventions that save lives, connect people who use drugs to supportive care and resources, reduce transmission of HIV and viral hepatitis, and reduce syringe litter. Governor Hochul must authorize OPCs throughout New York State, allowing other localities to benefit from this life-saving intervention. Our advocacy to end the epidemic for all New Yorkers is more urgent than ever. In light of the presidential election, we must renew our fight for health equity, human dignity, and the resources needed to finish this battle. We are still here until there's housing, healthcare, and justice for all. Thank you all for your relentless advocacy to ending the epidemic this past year, and in advance for joining us in another year of advocating for ourselves and our community. Please feel free to join us in the reading today. Stay and listen to the names for as long as you'd like. Mingle through the tables of wonderful organizations here and be in community with others. Thank you for joining us and enjoy. Michelle B. Michelle Mary Bernilli. Mick Godwin. Michael Foster. Mickey Talbot. Mickey Stewart Haney.
Martin Miller.
Miguel Anglada
Ben
Jr.
Allison.
Miguel
Ben
Delgado.
Cedillo. Ben
Miguel R.
Allen Smith. Ben
Miguel.
Ben Freeman.
Miguel Angel Tapia.
Ben
Mike Abrams.
Ben
Mike
Thomas
Hudson.
Ben
Mike Bell.
Ben
Marlene
Mike Breeze.
Benino.
Marlon
Mike
Benjamin
Castle.
Thomas.
Mike
Monroe
Giavetta.
Blackett,
Benjamin Edwards.
Mike Clement.
Ben Marshall.
Mike Cook.
Benny Gonzalez.
Mike Crawford.
Ayala.
Michelle Harper.
Belinda.
Michelle Renee Bremer. Mick Green. Mikkel Blue.
Ben Connor.
Mickey.
Ben Alpha.
Mickey D. Clymer. Miguel Aponte. Miguel Elias. Miguel Rivera. Miguel A. Elias. Miguel J. Foss. Mike Antonio. Mike Bain. Mike Phelps. Mike Callahan. Mike Castle. Mike Siggy. Mike Cleveland. Mike Costello. Mike Cruz. Michelle. Mick Carey. Mick. Mickey Angel. Mickey. Midnight. Miguel Casanova. Miguel Esquivel. Miguel. Miguel A. Elias. Miho. Mike Austin. Mike Big Hester. Mike Bird. Mike Carney. Mike Cathers. Mike Penn. Mike Cornwell. Mike Silverstone. Mike D. Michelle. Nick Flanagan. Mick. Mickey. Mai. Miguel Cruz. Miguel Neely. Miguel. Miguel A. Calderon Rivera. Mike A.
For me. All right.
Mike.
You ready?
Yeah, just hit the red button, right?
This already is. This already is.
Okay.
So, good morning. Thank you for watching this video. Please like, subscribe, and comment on the video. Today, as you know, most people you know that I'm atheist. I don't believe in God and religious books. And this month is not only HIV/AIDS month, it's also ex-Muslims month, where Muslims have come out of the closet and say no longer want to accept your PF religion to expose Islam, because we need to expose it for what it is. Thank you, ex-Muslims, for exposing Islam, because yes, I'm also against Sharia law. Say no to Sharia law. Whatever I said in this video is my words. I do not represent any organization. I represent Dinik Martinez. You know who Dinik Martinez is? Dinick Martinez. Follow me, subscribe, and comment, because religions there's so many Hindus are being killed in Bangladesh by Muslims mob. It's right on YouTube. You can look it up. So we need to support our Hindu brothers and sisters, and the Jewish brothers and sisters also. But we need to support each other. So thank you, ex-Muslims, for exposing Islam. I'm with you, and we need to expose it for what it is. No more Sharia law. say no and say no and say no and hell no to Sharia law. Thank you.
All right. Try to make sure the video stays like steady.
Thank you.
Ernesto, David Gutierrez, David McKenzie, David Shannon, David Wood, Deborah Romero,
Scenario Gordon Bradley,
Dennis
Gordon
Baggins,
Sala, Hogan, Len Powell, Len Sweet, Len Weaver, Len Williams, Glenn Patty Paparella, Glenn Aaron Peyton Smith, Glenn Owen Bibb, Glenn Angie Huffman, Gloria, Linda, John Street, The Baghdad, Gordon B, Gordon Cass, Gordon Dunn, Gordon J, Michael Gayes, Gordon Ovia, Michael Carlos, Gordon Michael Pineda, Gordon J. Simmons, Gordon W. Gordon Michael Laparze, Grady Michael Madison Graham Walsh, Graham B. Michael Batista, Graham Petit, Graham Michael Maxi, Grant Marlboro, Grant M. Collins, Gray House, Michael Gray Aldrich, Michael Carter, Gordon Francis, Michael Gordon Young, Gordon Michael Mola, Michael Gordon James, Michael Curtis, Grace, Michael Lawrence, Grady, Michael Evans, Michael Grant Michael Taylor, Grant Michael Gray, Michael Barr, Michael Gordon Young, Richard Gordon, Michael Rountree, Gordon William Michael, Gordon Sharir, Gordon Michael, Grace, Brady, Michael Graham, Graham, Michael Anthony McBernard, Michael Garcia Bano, Douglas, Michael David Rogers, Grant T. Gordon, Michael Anthony, Michael Murray, Gordon Emery, Gordon Scott, Michael Phillip, Smith, Michael R. Raymond J. Freeze, Grant Michael Richardson, Grant Page, Michael Ross, Grant Sophie, Grant Michael Grant, Grant Michael Strongberg, Greg Michael Stevens, Greg B, Greg Michael Graham, Greg Berger, Michael Ron Sala, Greg Michael Wilgrave, Michael J. Dyson, George Joseph, Michael Jason Paul Hammond, Greg Campbell, Michael Michelle Elliott, Greg Tony, Greg Michael Patrick Brennan, Greg Michael Greg Greg Michael Clark, Greg Hooks, Michael Rodriguez, Greg Morgan, Greg Michael Rude, Greg Shu, Greg Soldberg, Michael Greg Sprout, Greg Cologne, Michael Larry Burr, Greg Andrew, Michael Steiner, Greg Hutchinson, Michael Homer, Greg Clark, Greg Michael Vernon, Greg Davis, Michael Davis, Greg Diamond, Michael Ross, Greg Hatch, Greg Michael, Greg Registered Greg Kimberly, Jared Michael R. Peters, Greg Shu, Michael Greg Sprout, Greg Vandenberg, Michael Greg Max, Greg Harley, Greg Michael Jared Smith, T.D. Harry Michael Jerry Greg Michael Joseph Grinton Michael Levy Greg Michael R. Greg Meadows Michael Papels Greg Spooner Michael Razin Greg Cameron Greg Michael Rosa Greg Williams George Michael Russell Greg Gerard Jenkins Greg Michael Asoro Greg S. Michael Forten G. Glenn Cartwright Michael Tambon Greg P. Pastrado Michael Tony Gregory Clark Gregory Gill Michael Gregory J. Harry Gregory Moore Michael Rosen Gregory Michael Moses Gregory D. Michael Gregory Morrow Gregory Michael Gregory John Michael Gregory Paul Gregory Michael Gregory George Michael Gold George J. S. Hartman Michael Joseph Miller Gerard Reynolds Michael Lorenzo Brown Greg Smith Reynolds Michael Ray Alberto Gregory Cole Michael Raymond Vasquez Gregory Malinowski Michael F. Gregory Worrell Michael Harrison Michael Burton Gregory Michelle Foster David Michelle Michelle Carlo Michelle Johnson Michelle Waller Gregory Nick Maria Jacinto Ricky Dallas Migdalia J. Miguel Camargo Gregory James Miguel Gregoria Jean Miguel Jeffrey Williams Miguel Jesse Miguel Martinez Gregory Miguel John Miguel John Davis Miguel John Gregory Michael Ramon Vasquez Michael Sidney Carter Miguel Michelle Brown Michelle Mogulet Gregory Michelle James Brown James Michelle Michelle Rosenthal Michelle Wells Jeffrey Mickey Mickey Jesse Migdalia Migdalia Mejia Miguel Devali Miguel Ferdinand Miguel Torres Jr. Miguel Perry
Nicholas Brown
Miguel Morales Miguel Reyes Miguel Salvani Miguel Manuel Lopez Michael Raymond Vasquez Miguel Jack Winnington Michael James Michelle James Dancer Michelle Washington James Moore Michelle James Wright James Michelle Carrington Jasmine Michelle Javier Valencia.
En ese lugar que está ahí, antes era un hospital. Y me han dicho a mí que mucha gente murió de VIH en los 80, 90, de 2000. ¿Cuánta gente murió ha muerto aproximadamente?
Claramente
Aproximado, porque no tenemos un número exacto.
era cerca de más de 6.000, 8.000 personas.
¿En total o por día?
No, pues el tiempo, por día era tremendo. En los 80, yo creo que era 100 o más cada día. Pero yo no tengo...
Ese era un hospital antes.
Este era San Vincent.
Sí, y que dicen que mucha gente murió ahí.
Y tenía un, que le dice en inglés, un HIV/AIDS designation en su tiempo.
HIV vaccination.
para coger los fondos. Pero eso se lo quitó cuando llegó al hospital.
Oh, ok. De San Vincent. Gracias. El hospital, donde era el hospital San Vincent antes. This is a video.
Down here at the AIDS Memorial to honor those who have passed away from complication of HIV or AIDS. My sister, Tammy Matthews, she had passed away from the complication at the age of 34, and then since 1994 she had passed. She would have been 60 years old September of this year. She was my first sibling that had died, and I lost 3 before already, but she was the first and the most difficult one to see leave. She was 2 years younger than I am. She had left 3 beautiful children. She got about 10 grands now. She would have been a great grandmother. She was a good sister, and she's still missed today.
Thank you. Thank you for sharing the lovely story. Super being prepared.
Michelle Shockers,
And it's gonna be there. All day.
Modesto Santiago, Henry Fonseca, Henry
Jack Williams, Bill Odoms, Isaac Wilson, Isaac Flores,
Steve
Rodriguez, Israel Rodriguez, Vincent Delmar, Evan Dario Eshel Smith, Israel Howell, Howie Hare, Ivan Easter, Hollywood, Ivan Polanco, Hope, Ivory Bell Morris, Jay Horatio Montoya, Horse Spy, Tacito Moya, Howard Ashak, Mario Jalid, James Abrams, James Albert, James Archer, James Bosch, James Correa, James Bosch, Kodishka, James Hudson, Hugh Cunningham, James Hugo, Humberto Fields, James Highlands, James Griggs, James Greenwood, James Long, Ian Charles, Iris, Michael Calais, Isaiah,
Reverend Peter
Israel Sultan, Israel Lewis III, Ivan Bradley, Ivan Sutton, Yvonne B. James Yvonne J.A. Jake Price, J.A.
Robert
J. Hardy,
William Burns,
Ron Nelson,
JB, Jeanette Contento,
Paul,
Jamie Jackson,
Pat
Gonzalez, Janice White, Pat LeBron,
Michael Patra,
Dean
W. Jeffrey Judge, Jeffrey Frederick Perry, Jeffrey Karen Loyal, Jeffrey Lee Corvette, Jeffrey Lynn, Jack Bivoni, Jeffrey Van Lane, Jeffrey 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 Martin Coleman, Jeffrey Scott Edwards, Jeffrey W. Jeffrey Williams, Jeffrey Hale, Jeannie Karen, Jennifer Acevedo, Jennifer Schmuck, Jennifer Jeremiah Bush, Jeffrey Chadlock,
Paul Harmon,
Mr. High Thompson,
Paul Edwards, Paul Hernandez. Paula Wells. Jerome Harrington. Jack Jerome. Jack Gillette. Paul Connors. Jack Paul Hunter. Jack Heath. Jerome Jack Todd, Jack Boston, Jerry Fish, Jerry Glover, Jerry Grabber, Jerry Grant, Jerry King, Jerry Hernandez, Jerry Kardashian.
Getting ready for the rally, for the press conference. This is me, right here. Yes, I'm against Sharia law. Danny Martinez is against Sharia law. Proud against Sharia law. Getting ready for the press conference. Yes. We're not only honoring HIV/AIDS, honoring those ex-Muslims. Ex-Muslim, we're celebrating ex-Muslim month. Ex-Muslims month.
I need more. Okay.
Arroyo, Paul W. Jeff Lee Jr.
Hello, how are you?
Good, how you doing?
Yes.
Smith,
This is an ex-Muslim month too for exposing Islam.
Pedro Morales,
Oh yeah?
Ex-Muslim month also.
One more person.
Yes, we're exposing Islam. So we celebrate that too.
Harry
You don't have to do anything.
Harry Harden,
You want to do it? Thank you.
Harry Watson,
Hi, how are you?
Harry Senior,
You came in red. You came just for the occasion. Look at her, she came for the occasion.
Peter Allen, Austin, L. W. Cutter, Paula, Paul
We have the elected officials.
Chrome Suggs, Pedro Carrasquillo, Pedro Sombra, Pedro, Peggy, Penny, Capo, Harry Confessor, Harry Ferguson, Harry Hogan, Harry Thomas, Harry Watson, Pete Bahanen, Pete Gioro,
How's the soup? Do you like it?
Welcome here. Every hour, on the hour, we are reading a statement. Thank you all for coming. Hello, and thank you for joining us at New York City AIDS Memorial for our World AIDS Day commemoration. The reading of the names today we gather to collectively mourn and honor those who we have lost to HIV/AIDS over the past 5 decades in this devastating epidemic. Since its onset, more than 500,000 people in the United States have died of AIDS. Tragically, the epidemic continues. In 2023, around 630,000 people died from AIDS-related illness worldwide. Housing Works began its tradition of reading the names in December 1995, emerging from an act of civil disobedience and a 24-hour reading of the names. This year, more than 140 volunteers have come together to read over a list of 30,000 community source names, continuing this powerful act of remembrance and resistance. The tradition is not only about mourning, it's also a call to action. While it's important to acknowledge how far we've come from the dark days of silence and stigma to life-saving treatments and prevention strategies that offer hope, we must also face the reality that much of this progress remains fragile. The HIV/AIDS epidemic is not over in every community. Disparities in access to HIV prevention treatment, the life-saving housing continues to prevail amongst communities of color, women, older adults, and those living upstate and on Long Island. To address these disparities, The Ending AIDS New York Community Coalition calls on our governor and our New York State legislature to take action on the following priorities to end the epidemic across the state. First, house all New Yorkers with HIV. Research shows that stable housing is the most critical factor for health of people living with HIV and is key to preventing the virus from spreading. In New York City, HASA has helped over 28,000 low-income New Yorkers with HIV secure and maintain housing. Yet up to 2,735 living upstate in Long Island have been left behind because this program is not available outside of New York City. Governor Hochul has the power to end homelessness for people with HIV, so we call on her to provide equitable access to rental assistance for low-income New Yorkers with HIV in every locality, saving lives and money. Second, we must enhance access to PrEP amongst communities most at risk for HIV transmission. We now have effective medication that prevents HIV transmission, known as PrEP-PEP. Yet stark disparities in PrEP uptake amongst people of color, women, older adults undermine the potential of this powerful HIV prevention tool. We demand investments in tailored, cultural competent outreach that reduce barriers to access to PrEP regardless of insurance. Val?
Peter Pichel. Peter Burrell. Ramon Gonzalez. We must also support New Yorkers aging with HIV. By 2030, 70% of New Yorkers living with HIV will be over the age of 50. Aging with HIV can increase the risk of other health conditions as well as higher levels of depression and social isolation due to the effects of HIV stigma from losing friends and community members at the height of the HIV/AIDS epidemic. To adequately address the unique medical and social needs of long-term survivors, New York must prioritize investments in targeted support and services for older adults. Fourth, we must invest in jobs for HIV peer workers by reflecting and representing the communities in which they work. Peer workers support our goals to improve health equity and reduce disparities. Employing peer workers is a cost-effective strategy to expand healthcare access, help under-resourced organizations, and create economic opportunities. New York must strengthen employment opportunities, workforce readiness, and job placement services for peer workers. And finally, we call on Governor Hochul to authorize overdose prevention centers statewide. OPCs are vital interventions that save lives. Connect people who use drugs to supportive care and resources, reduce transmission of HIV and viral hepatitis, and reduce syringe litter. Governor Hochul must authorize OPCs throughout New York State, allowing other localities to benefit from this life-saving intervention. Our advocacy to end the epidemic for all New Yorkers is more urgent than ever. In light of the presidential election, we must renew our fight for health equity, human dignity, and the resources to finish this battle. We are still here until there's housing, healthcare, and justice for all. Thank you all for your relentless advocacy in ending the epidemic this past year, and in advance for joining us in another year of advocating for ourselves and our community. Please feel free to join in the reading today. Stay and listen to the names for as long as you would like. Mingle through the tables of wonderful organizations here and be in community with others. Thank you for joining us today.
When I say what do we want, you say end HIV. What do we want? End HIV. What do we want? End HIV. When I say when do we want it, you say now. When do we want it? Now. When do we want it? Now. And if we don't get it, you say people die. If we don't get it, if we don't get it, if we don't get it, what do we want?
Peter Sheriff.
And the HIV.
Peter Simpson.
What do we want? When do we want it? Now. When do we want it? Now. What do we want? Now. When do we want it? Now. And we don't get it. And we don't get it. And we don't get it.
Peter Evan Crane. Peter J. Godfrey. Peter James Austin. Peter Lawrence Gonzalez, Peter Chad Miller, Peter W. Andrews, Peter Walter Vaughan, Phil
And now we'd like to introduce an ally to the HIV/AIDS community, Linda Rosenthal, Assembly member.
Linda Rosenthal! Linda Rosenthal!
Hello, everyone. I guess it's about a year since we gathered together to mark World AIDS Day. And sadly, this is the 36th annual World AIDS Day. I'm Assembly Member Linda Rosenthal. I represent the Upper West Side, parts of Hell's Kitchen in Manhattan. I'm chair of the Assembly Housing Committee, and I want to thank Housing Works, the entire End AIDS Coalition, who I've worked with for many years, and I'm proud to stand here with you today. So we've come a long way in combating the stigma that was so interwoven with an HIV diagnosis. There are medications available in countries across the world to manage infection, and through antiviral therapy, we've sent the message that undetectable equals untransmittable, and it's absolutely possible, and so many people do continue to live a good and healthy life if they have HIV. This year's global theme is Sustain and Accelerate HIV Progress. I'm proud to be partnering with all of you to do just that. This past June, I passed legislation into law to prohibit private insurance companies from requiring prior authorization or imposing other delays on the dispensing of medications to prevent and treat HIV. This is another trick that insurance companies have foisted upon the American public, but here in New York State, we have eliminated the prior authorization requirement. No one should be delayed in getting their medications because of bureaucratic insurance delays that benefit the insurers, not the patients themselves. So we've come a long way, but there's so much more to do, and we must be, and I know we all are, concerned about what the incoming administration plans to do. The Department of Health and Human Services could be led by a man who has spread AIDS denialism, alleging that AIDS was the result of recreational drug use by gay men and lifestyle factors, rather than being caused by the HIV virus. So now more than ever, we have to be steadfast
That's Robert F. Kennedy.
to protect those with HIV/AIDS, and our coalition will need to mobilize against the disinformation and this dangerous policies coming our way. At the state level, I will continue to sponsor and talk about and push my bill to establish overdose consumption sites, which I've had for some years, which we know, it's the 3rd anniversary of On Point, we know how many lives have been saved. That is the bottom line, to save lives. It's going to be even more challenging with this new administration, but that does not mean that we give up. It just means we fight harder.
Exactly.
So I'm committed to fighting harder with all of you. You know, the AIDS quilt is being exhibited at the White House this week, and we need to remember that we are fighting in memory and in honor of those who perished, including my friends Jeffrey Poff and David Bouchard, and we will continue to fight together until the end of AIDS is actually a reality. Thank you.
So let's start some chants again. Fight, fight, fight. People with AIDS don't have to die. Fight, fight, fight. People with AIDS don't have to die. Louder. Fight, fight, fight. People with AIDS don't have to die. Fight, fight, fight. People with AIDS have human rights. Again, fight, fight, fight. People with AIDS have human rights. Fight, fight, fight. Matt.
And now we'd like to call up another healthcare ally, someone that that is going to be crucial to get a lot of the priorities passed. Tony Simone, thank you, our assembly member.
Tony Simone!
Good morning,
Tony
everyone.
Simone.
I'm Assemblymember Tony Simone. I represent the west side of Manhattan. We're here for one common purpose, to remember all those that we have lost to the AIDS pandemic. Could you imagine if we had treated the HIV/AIDS pandemic as we did COVID? Could you imagine if we would have realized during the Reagan administration how evil he was to ignore us? I grew up in the outer borough of Queens, and I remember an older teenager, I was an adolescent, who I was oddly attracted to. And it wasn't just his looks, it was where was he going in New York City, what was he doing? And I remember one day, he looked different, and he didn't look well. And I asked my parents, what's up? What's up with him? And luckily my parents were positive about it and said he has HIV/AIDS. He's an openly gay man, and I was scared because I guess I started to realize who I was. And the kids in the neighborhood would taunt him and often mock him with anti-gay slurs. And I didn't know why. And I would hear these negative things even in my own family because of their ignorance to AIDS, HIV/AIDS. And even today, we've lost almost 1 million folks, brothers and sisters across the world, to this terrible pandemic. We can't stop fighting until there's a cure and a vaccine. And we must do this not just on World AIDS Day, which was actually yesterday. On this sunny day, we have to remember all the lost souls. Another quick story is I remember being at a good friend Kevin's house on the Upper West Side, and he had these beautiful photos of all these really attractive men, and really, they were so close, and I was like, Kevin, have you kept in touch with them? That's how naive I was. Where are they now? And he said, only 2 of us are alive. And to think many of our youth today forget what many went through. I grew up in the 90s, so it was at the tail end of seeing how many we lost, but people forget it's still a pandemic and epidemic. We still don't have a cure. We still have to fight for housing and health care for people with HIV/AIDS living in poverty. We cannot forget that. Everyone should be housed in New York, including folks who are challenged by their health conditions and HIV/AIDS. We have to continue to make access to PrEP easy. No, delaying PrEP for men who have sex with men. We have to continue to talk about this, that it's still a pandemic and still an epidemic. And until we have a cure, we can never stop fighting and make sure that we bond together over it. We have to remember the positive side of a terrible crisis we went through. From it came ACT UP. We learned to politically organize. We learned to elect LGBT openly living with HIV/AIDS folks like Tom DeWayne, State Senator Tom DeWayne, and others to elected office. Until everyone realizes in the world that HIV/AIDS affects the most marginalized communities across this world, we can't stop fighting. I want to thank Housing Works and all the organizations for organizing World AIDS Day. Until we find a cure, until we realize this terrible pandemic still rages on, we must keep fighting and advocating and educating the public. Thank you so much for letting me speak.
Tony Simone! Hi.
Thank you. Our next speaker is Joe Presley. He's the Vice President of Public Policy and Government Relations for Medicare, and he's going to speak on PrEP equity.
Yes! What's his name?
Good morning, everyone. Get apart. We have a bit of a cold.
What's
But
your
good
name?
morning on this beautiful sunny morning. My name is Joe Presley, and my pronouns are he and him. I'm the Vice President of Public Policy and Government Relations for Medicare. Currently serving nearly 10,000 members throughout our 5 boroughs. Medicare is a private, nonprofit community health plan that specializes in providing comprehensive health coverage and coordinated care to Medicaid members with chronic conditions, including HIV and AIDS and behavioral health issues. We serve people living with HIV and AIDS, people who are experiencing homelessness, regardless of HIV status, and people of transgender experience, regardless of HIV status. I am here today to speak about PrEP equity. The provision of PrEP to all communities is a cornerstone of ending the HIV/AIDS epidemic. In his State of the Union address in 2019, incoming President-elect Donald Trump, then President, called for the elimination of HIV transmissions in the United States. Admittedly, getting him to say such required the tireless advocacy of scores of advocates from across the country, working closely with policymakers inside of government and with policymakers hailing from both parties. It is now 2024, and we call upon policymakers, government actors, pharmaceuticals, to do all that they can to ensure that we continue the all-important fight of once and for all ending the HIV/AIDS epidemic. Critical tools in the war chest to end AIDS will be ensuring that pre-exposure prophylaxis, known as PrEP, be available to communities across the nation. As proven, PrEP is a super highly effective tool at reducing the risk of acquiring HIV. However, once again, as we have seen time and time and time again, the color of your skin, your gender, your income, and where you live are barriers to accessing a life-saving intervention. The current available interventions, which consist of separate oral and intravenous therapy, are highly effective, and newer modalities that often give even greater efficiency with twice-yearly subcutaneous injections facilitate even greater adherence. PrEP, which is proven to be 99% effective at preventing new HIV transmissions, is the most powerful tool we have in our arsenal in our efforts to end the epidemic. But too few people placed at elevated risk for HIV access to treatment. To build on the momentum towards ending the HIV/AIDS epidemic, New York must continue to address the persistent healthcare inequity outlined in the past by many of the advocates standing here today. Young men of color who have sex with men, women of color, and people who use drugs continue to lag far behind any significant gains seen in lowering new transmissions. In 2022, 83% of the newly diagnosed with HIV in New York City were Black or Latino. 85% of new diagnoses amongst women were Black or Latino, and nearly half of all new HIV infections were seen in people who hailed from high or very high resource challenged zip codes at the time of the diagnosis. Once again, the color of your skin, your gender, and your address can often send you to the back of the line in accessing life-saving interventions. In closing, I just want to add that if Medicare stands steadfast in its call to end the HIV/AIDS epidemic, building and maintaining partnerships between pharmaceuticals, all levels of government, regardless of political identification, and advocates, we must ensure that we double down and provide access to these game-changing innovations. Innovations that prevent the spread of HIV, enhance lives, and suppress the presence of the HIV virus to achieve the goal of eradicating it once and for all from our communities. Together, we can end HIV by both caring for people living with HIV and working to prevent new infections. We should, no, we must provide equal access to PrEP for all. Thank you.
Yes, Joe.
Brother Peter G. Richie Medina. Robert Heller.
Thank you, Joe. Our next speaker is Libby Stevenson, Program Manager for the Peer Workforce and Peer Alumni at the Alliance for Positive Change, and she's going to speak on peer workforce. Sorry, him. Sorry.
Russell Kidney. Samantha. Sandra Barker. Santiago Morelos. Sarat. Randy Ted.
Good morning.
Good morning.
Levi Stevenson. I'm the program manager for the Alliance for Positive Change for the Peer Workforce. Several years ago, if someone had asked me, what is the definition of a peer? I wouldn't have been able to provide an answer. Today, thanks to completing peer training and working as a peer for 6 years, I understand the power and the effectiveness of peer work. In organizations such as the Alliance for Positive Change or housing work that serve the disadvantaged community, peers play an invaluable role as vital connectors, sharing their knowledge and experience to empower others and foster a sense of belonging. By leveraging their lived experiences, peers positively impact these communities. They educate others, promote resilience. Peers positively inspire hope and motivation. Peers are living, breathing role models. They demonstrate how life challenges can be overcome through commitment, hard work, and the power of second chances. Governor Hochul, financial resources are necessary to provide peers with training and support. Peer work training offers these benefits to both peers and organizations they work for. Professional development, improved expertise, customized learning, increased collaboration, improved confidence, better working environment, and a bridge to disadvantaged communities. Investing in the HIV/AIDS employment initiative across New York State will ensure vocational support and job placement in every county. Additionally, investing in workforce readiness and job placement services will connect peer workers to quality jobs in health and human services organizations. This will serve diverse communities and offer pathways for career advancement, allowing peer workers to grow in their roles, expand their skills, earn a living wage, and forge professional networks. This will help end the epidemic of HIV/AIDS, as well as other chronic diseases. We need more resources to provide the opportunity for peer workers to reach others and to help overcome their challenges and to climb out of the cycle of poverty. Thank you.
Let's get up to another chat. Let's put energy into this so everyone hears us. All right? When I say what do we want, you say I end to HIV. When do we want it? Now. What do we want?
An end to HIV.
When do we want it?
Now.
What do we want?
An end to HIV.
When do we want it?
Now.
What do we want?
An end to HIV.
When do we want it?
Now.
Louder. What do we want?
An end to HIV.
When do we want it?
Now.
We also would like to acknowledge our representative from the New York City Council, Frank Giunta. Thank you for coming. And our next speaker is going to be our very own Adrienne McKenzie.
Good morning, everyone.
Good morning.
I don't have a lot to say as the gentleman did, but I will say this. I'm a resident of Amsterdam, Harlem for 14 years, and I've seen the change that housing has led and meant to people living with HIV and AIDS. We have seen people coming down housing programs feel renewed. They don't use drugs as much. Having a place to rest and call their own is a blessing. Several years ago, Frank Cuomo got evicted. He was on the verge of signing a bill that would have opened up access to people living in Long Island, upstate New York. Right now, with Governor Hochul, the program for that is only in New York City. We need her to provide resources for people living in Long Island and upstate New York to be able to find housing. Because housing is health care. Housing gives them security, and housing is something positive. So I'm calling on Governor Hochul to please provide the funds that are needed to keep upstate and Long Island for these programs that are needed to make their lives better. Thank you.
Thank you, Adrian. And our last speaker today, Nia Nottage from Act Up Priorities.
Victoria. Adrian Briggs.
My name is Nia Nottage, and I use they, them pronouns, and I'm a co-organizer with ACT UP New York. I'm here today on World AIDS Day to honor the legacies of the activists who come before me to fight for a cure to HIV, to fight to end the stigma and criminalization around people living with it, and to fight for access to healthcare services, free and affordable testing, treatment, healthcare, mental health services, food, and housing that we all deserve without fear of discrimination because of our HIV status, sexual preferences, gender, relationship to drugs, or anything else. Because New York City has been one of the main convergences of the epidemic, we have been able to win many free and accessible health services over the years. Services which this current administration under Mayor Eric Adams has sought to dismantle through inattention and budgetary neglect. In a year when the Department of Health and Mental Hygiene lost millions of dollars of federal support due to the premature end of the emergency funding around the COVID-19 pandemic, Mayor Adams docked the public health budget even further by cutting city funding and providing $455 million less to public health in the fiscal year of 2025 than was provided in the previous year. An end to emergency federal funding is supposed to be a passing of the baton to local governments to increase their budgets, to continue to shore up the extra need which is no longer emergency and has now become quotidian, and therefore the responsibility of the city and state. But in Adams' budget, funding for reproductive and sexual health services, for viral hepatitis prevention, for the Access to Health Initiative, cancer services, and the Ending the Epidemic Initiative stayed the exact same as the year before. Funding to support New Yorkers in maintaining their health around newer and concurrent pandemics like COVID and Mpox, both of which can worsen health outcomes for people with HIV, was not provided. The Department of Health and Mental Hygiene has faced a 307-person reduction in its staff since 2024. That's a reduction of 4%. All of this while the free condom program has lost important contractors who deliver condoms to NYC bars, leaving these bars without consistent access to condoms. There are only 2 sexual health clinics in Queens, only 1 clinic apiece in the boroughs of the Bronx, Harlem, Brooklyn, and Manhattan, and no sexual health clinics in all of Staten Island. Services such as medication abortion, Doxy, PEP, and PrEP continuity of care are only available at certain clinic locations due to lack of funding. All clinic locations are only open from 8:30 a.m. to 3:30 p.m. and only weekdays to encourage New Yorkers to get there early and line up, as clinics might close earlier if capacity is reached. Extended hours are available in Brooklyn and Chelsea for 2 hours, 1 day each week, from 5 to 7 on Tuesdays to try to combat the overflow. This leaves patients who work a 9-to-5 job, or NYC school students, or anyone else who cannot devote an entire day to lining up and only maybe getting seen, have 2 hours each Tuesday evening to try to commute to Chelsea or Fort Greene in order to make the express clinic hours. These express clinics, unlike their daytime counterparts, do not provide PEP, PrEP, HIV treatment, Plan B, syphilis treatment, or Mpox vaccines. Additionally, PCR COVID testing centers were closed this year in Manhattan, the Bronx, and Queens, leaving only a single testing site standing in all 5 boroughs in Brooklyn. And ACT UP was told that even that one was going to close this summer, but we held a town hall in May and invited DOHMH representatives and asked questions, and now somehow it hasn't. These are the city's free services around reproduction, viruses, and STIs to help us maintain our health around current and future pandemics. These are the only services available to New Yorkers without insurance, New York City residency, or even home addresses. The only services available to all of us without need for prior registration, regardless of the state of our job or immigration status or anything else might find us in. These are our baseline protections, and they're in total jeopardy. because the funding is being cut, because the funding is being stalled, because they're understaffed, because they're not open on nights or weekends, they're under-advertised, so not enough people know about them to complain, and they're not being maintained. In fiscal year 2025, the police budget was one of the top 6 most funded sectors in this year's city budget, was $5.83 billion. The Department of Health and Mental Hygiene's budget was $2.57 billion. Another public safety institution, the fire department, also had a budget of $2.57 billion. So why does the NYPD get so much more? Because Mayor Adams doesn't care about providing a free and stable health safety net, but he does care about police. And while he's also being accused of having used illegal campaign donations to steal public funds, we demand that Mayor Adams restore funding to our public health safety net. And we echo City Council members Tiffany Caban, Chi Oze, Shahana Hanif, Alexa Alviles, Eric Botcher, and 13 other council members' sentiments that he must resign or be unseated for the damage that he's inflicted on this city. Every cent of funding for HIV/AIDS programs is the direct result of tireless generations of activists, many of whom were killed by the disease that they were fighting to stop. Their deaths were an intentional failure of the government to protect them. Now, thanks to Mayor Adams' neglect, our government continues to fail its people by stripping care for AIDS as well as new epidemics like COVID and Mpox. March with us today at 1 p.m. from the AIDS Memorial to the 5th Avenue Trump Tower to say, healthcare not warfare. End the Eric Adams, Donald Trump agenda of dismantling the health system. We deserve a robust public health system. This is the 36th World AIDS Day, and this has to stop. Thank you.
Let's do one more chant. Fight, fight, fight. People with AIDS don't have to die. Fight, fight, fight. People with AIDS have human rights. Fight, fight, fight. People with AIDS don't have to die. Fight, fight, fight. People with AIDS have human rights. Fight, fight, fight.
Julio Gonzalez.
Fight, fight, fight.
Julio Hernandez.
Fight, fight, fight. Fight, fight, fight.
Julio Martinez.
Rosima Rivera.
Julio
Martinez. James Staton.
Julio Milan.
Janet Jackson.
Julio Montoya.
Ron Jenkins.
It's finished.
Jeff
They're finished, right?
Reverend Tim Raven.
Jerome.
Okay.
Reverend Brent.
Catherine.
Reverend Charles.
Jesus Garcia. Jesus Garcia.
Hi, how are you?
Okay, how's it going?
I don't remember you.
Okay. John Kevin Wilkes. Jonathan Nathan. Jose Polino.
People enjoying the soup?
Julio. Georgia Brooks. Gordon Cuddy. Harold Jenkins.
There's the soup.
Jackie Hill. Jeff Kline.
Look at the soup. Una reina con unos lentes, miren eso.
Carissa Curry. Andy.
Hello, and thank you for joining us at the New York City AIDS Memorial for our World AIDS Day commemorating the reading of the names. Today we gather to collectively mourn and honor those who have lost to HIV/AIDS over the past 5 decades of this devastating epidemic. Since its onset, more than 500,000 people in the United States have died of AIDS. Tragically, the epidemic continues. In 2023, around 630,000 people died from AIDS-related illnesses worldwide. Housing Works began the tradition of the reading of the names in December 1995. emerging from an act of civil disobedience and a 24-hour beating of them. This year, more than 140 volunteers have come together to read from a list of over 30,000 community sources, continuing this powerful act of remembrance and resistance. This tradition is not only about mourning, it's also a call to action. While it's important to acknowledge how far we've come from the days of silence and stigma to life-saving treatments and prevention strategies that offer hope, we must also face the reality that much of this progress remains fragile. The HIV and AIDS epidemic is not over in every community. Disparities in access to HIV prevention treatment and life-saving housing continues to prevail among communities of color, women, older adults, and those living upstate and on Long Island. To address these disparities, the Ending AIDS New York Community Coalition calls for our governor and the New York State legislature to take action on the following priorities to end the epidemic across the state. First, house all New Yorkers with HIV. Research shows that stable housing is the most critical factor of the health of people with HIV and is key to preventing the virus from spreading. In New York City, HASA has helped over 28,000 low-income New Yorkers with HIV secure and maintain housing. Yet, up to 235 living upstate and Long Island have been left behind because this program is not available outside of New York City. Governor Hochul has the power to end homelessness for people with HIV, and so we call on her to provide equitable access to rental assistance for low-income New Yorkers with HIV in every locality, saving lives and money. Second, we must enhance access to PrEP amongst communities most at risk for HIV transmission. We now have highly effective medication to prevent HIV transmission, known as PrEP/PEP. Yet stark disparities in PrEP uptake among persons of color, women, and older adults undermine the potential of this powerful HIV prevention tool. We demand investments in tailored, culturally competent outreach and reduce barriers to accessing PrEP regardless of insurance. We also must support New Yorkers aging with HIV. By 2030, 70% of New Yorkers living with HIV will be over the age of 50. Aging with HIV can increase the risk of other health conditions, as well as higher levels of depression and social isolation due to the effects of HIV stigma and from losing friends and community members at the height of the HIV/AIDS epidemic. To adequately address the unique medical and social needs of long-term survivors, New York must prioritize investments in target support and resources for older. Fourth, New York must invest in jobs for HIV peer workers. By reflecting and representing the communities in which they work, peer workers support our goals to improve health equity and reduce disparities. Employing peer workers is a cost-effective strategy to expand healthcare access, help under-resourced organizations, and create economic opportunities. New York must strengthen employment opportunities, workforce readiness, and job placement services for peer workers. And finally, we call on Governor Hochul to authorize overdose prevention statewide. OPCs are vital interventions that save lives, connect people who use drugs to supportive care and resources, reduce transmission of HIV and viral hepatitis, and reduce syringe litter. Governor Hochul must authorize OPCs throughout New York State, allowing other localities to benefit from this life-saving intervention.
Reina, ya voy. Reina.
Our advocacy to end the epidemic for all New Yorkers is more urgent than ever. In light of the presidential election, we must renew our fight for health equity, human dignity, and the resources needed to finish this battle. We're still here until there's housing, healthcare, and justice for all. Thank you all for your relentless advocacy to ending the epidemic this past year, and in advance for joining us in another year for advocating for ourselves and our community. Please feel free to join the meeting today. Stay and listen to the names as long as you would like. Mingle through the tables of wonderful organizations here and be in community with others. Thank you for joining us and enjoy.
Daniel Harris,
John D. Silva,
Dolores Avila, Dennis Lewis, Daniel Grant,
Washington Israel,
Daniel
Patrick
Faisal,
Jones,
Daniel Faisal, Daniel Kevin Grace,